Let's discuss Gallbladder 4, Hanyan, Jaw Serenity, a point of the eye system. GB4 is located at the junction of the upper quarter and the second quarter of a line connecting stomach 8 and GB7. How to find? First, locate the two reference points. Stomach 8, which is located 4.5 Tsun, lateral to the midline, and 0.5 Tsun within the anterior hairline at the corner of the forehead, and GB7 in the depression on the level of the apex of the ear within the circumauricular temporal hairline. Then divide the slightly curved line between these 2 points into quarters and locate GB4 at the junction of the upper quarter with the lower 3 quarters. Generally, GB4 is located on the temporal hairline and the anterior portion of the temporalis muscle, which can be felt when chewing. Needling 0.3 to 1.5 Tsun transversely or subcutaneously, tangentially along the skull in the direction of the occiput or towards the disorder or pain. Actions, indications: eliminates wind and heat, opens the channel. Special feature, meeting point with the TB and stomach channel. GB4 subdues liver yang, so good for headache, dizziness, blurred vision. Extinguishes interior wind, convulsions, lockjaw, epilepsy, deviation of eye and mouth. GB4 is an important local point for headaches from liver yang rising. It treats headaches also by virtue of its being a point of the eye system. It should be needled horizontally, that is, at a 15-degree angle towards the back of the head. Yan Zhengxi of the Ming Dynasty, in investigation of points along the channels, recommended GB4 specifically for head wind with pain in the region of both Taiyang points. Clinically, GB4 should always be palpated in cases of one-sided headache and needled if tender. Unusually for a point on the head, GB4 is also indicated in the Great Compendium of Acupuncture and Moxibustion for pain and stiffness of the wrist, as well as joint wind, that is, painful obstruction accompanied by sweating. GB4 is crossing point of GB, tripal heater, and stomach. Consider for one-sided headaches, tinnitus, or facial paralysis. Beneficial for tension in the jaws and a fullness at the corner of the forehead arising from frustration, anger, or impatience. This point is in the area which can bulge when we clench our jaw with rage or tension or fail to speak out. The meridian negotiates another about turn in direction here, and if the free flow of qi that is so important to the wood element is impeded, frustration can distort judgment. Stagnation can lead to the buildup of heat affecting the ears and eyes and to outbursts of impatience and anger. This point may be used to free the qi. GB4 activates the meridian and is used for neck pain, affecting the pathways of tripal heater and gallbladder. As a local point, the connection with the stomach meridian makes it a useful point for toothache, sneezing, facial paralysis, facial pain. GB4 eases pain locally and is classically used for pain in the wrist. It is useful for joint pain when accompanied by sweating. It is also said to settle fright. GB4 eliminates wind and is used for migraine, especially if one-sided, and particularly if there is pain along Taiyang, the SI and bladder channels. Also used when there is wind in the head, vertigo, epilepsy, or convulsions. Clears heat and is used for pain and redness of the outer canthus, used for visual dizziness and headaches when the body feels hot.